So you should understand what do you mean by blood pressure. Blood pressure is nothing but the pressure exerted by blood on the walls of your blood vessel. Whatever blood vessels are there in the body, particularly the aorta and veins. So pressure exerted by blood on the walls of arteries. That is nothing but the blood pressure. Now it is a normal around 120 by 80. That means systemic or systolic blood pressure should be 120 mm of Hg and diastolic blood pressure should be 80 mm of Hg mercury millimeter. So normally आपका blood pressure कितना होता है 120 by 80. 120 क्या है systolic blood pressure होता है and 80 क्या है diastolic blood pressure होता है. If there is any decrease in this blood pressure, that is known as a hypotension. Hypotension means decreased blood pressure than normal. Hypertension means what? Increased blood pressure than normal. So there is a, you should know what do you mean by hypertension. When you call a person is suffering from hypertension, when you call a person is suffering from hypertension, so there is one correlation chart. There is one correlation chart of blood pressure. So what is that? So blood pressure, what do you mean by blood pressure? Blood pressure is nothing but the pressure exerted by blood on the walls of arteries. जो आपके arteries है veins है उसके ऊपर जो pressure आता है blood की वजह से, that is known as the blood pressure. So blood pressure is nothing but the pressure exerted by blood on the walls of arteries. Now what is normal blood pressure? It is around 120 by 80. Again it is a range. Okay, so ऐसा नहीं कि 121 हो गया या फिर 81 हो गया तो आप hypertension है, ऐसा नहीं. It's again a range 120 by 80. So out of that 120 is known as the systolic blood pressure. Out of that 120 is known as the systolic blood pressure and 80 is known as a diastolic blood pressure. Okay, when a heart contracts, that is known as a systole, and at that time what is the pressure? That pressure is known as the systolic blood pressure. When heart will relax, that is known as the diastolic blood pressure. Now 120 by 80 is 120 by 80 mm of Hg mercury millimeter. That is the normal blood pressure. If there is decrease in this blood pressure known as a hypotension, and if there is increase in the blood pressure known as a hypertension. Okay, but when you call the person is suffering from hypotension or hypertension, so there is one correlation chart for this blood pressure. So you can see over here. So this is a correlation chart for blood pressure. So when you will see it is a hypotension or when you will see it is a hypertension. So you have to remember this. So you can see over here a category is mentioned in the first column. Then in the second column, the systolic blood pressure has been mentioned, and in the third column, diastolic blood pressure has been mentioned. So category means what? Category means type of hypertension or hypotension and diastolic. Now, what is the normal blood pressure? So normal blood pressure is nothing but the systolic blood pressure 80 to 120 and diastolic blood pressure 80 to 60 to 80. That means normal blood pressure is around 120 systolic and 80 diastolic. Okay, that is normal blood pressure. So if it is less than this, okay, so that is known as a hypotension. Okay, hypotension must means low blood pressure. So if systolic blood pressure is less than 80 mm of Hg, 80 mercury millimeter, systolic blood pressure less than 80 mm of Hg, and diastolic blood pressure less than 60 mm of Hg, that is known as a hypotension. Okay, less blood pressure. Normal blood pressure is around 80. Normal blood pressure is around 120 by 80. Systolic 120 and diastolic 180. Diastolic 80 mm of Hg. Now pre-hypertension. If pre-hypertension, pre-hypertension means what? When a systolic blood pressure, when a systolic blood pressure is around 120, 120 to 139 or 120 to 140, you can say. So if systolic blood pressure is 120 to 140 mm of Hg and diastolic blood pressure is around 80 to 89, then the that is known as a pre-hypertension. That is known as a pre-hypertension, and this pre-hypertension does not need any kind of treatment, and but this pre-hypertension may be converted into hypertension. ये जब pre-hypertension आता है पेशेंट में, तो अगर वो क्लियर नहीं हुआ तो उसका उसका कन्वर्जन होता है हाइपरटेंशन में, वो बाद में हाइपरटेंसिव हो जाता है. Now first hypertension stage 1. What do you mean by hypertension stage 1? So if your systolic blood pressure is around 140 to 160, if systolic blood pressure is around 140 to 160 and diastolic blood pressure is around 90 to 99, then the person is suffering from hypertension stage 1. Okay, then if what is meant by hypertension stage 2? So if systolic blood pressure is around 160 mm of Hg plus more than 160 mm of Hg, systolic blood pressure is there, and 100 mm of Hg, diastolic blood pressure is there. So if 160 plus and 100 plus systolic and diastolic blood pressure respectively, then that is nothing but the hypertension stage check. Very high blood pressure or hypertensive crisis. So if blood pressure is systolic blood pressure is more than 180 mm of Hg and diastolic blood pressure is around 1110 plus. So that means the patient is suffering from hypertensive crisis. So normal blood pressure आपका होता है 120 systolic, 80 diastolic. 120 by 80 mm of Hg. Blood pressure is measured by mercury millimeter. Now, if there is a decrease in blood pressure, that is known as hypotension. If there is increase in blood pressure, known as a hypertension. So pre hypertension में systolic blood pressure होता है around आपका 120 139, diastolic होता है around 80 89. Pre hypertension. उसके बाद में आता है hypertension stage 1. उसमें आपका systolic blood pressure आता है around 120 160 के आसपास और diastolic blood pressure आता है 90 to 99. Hypertension stage 2 में आता है systolic blood pressure आपका 160 plus, diastolic blood pressure आता है आपका 100 plus. Okay. So this hypertension pass 2 and hypertension stage 1, stage 2 and hypertensive crisis required immediate treatment. Okay, very high blood pressure or hypertensive crisis means what? If systolic blood pressure is more than 180 and diastolic blood pressure is around 1110 or plus, more than 1110, that is known as a hypertensive crisis. Now there are two kind of basically blood pressure. There are two basic types of blood pressure. There are two basic types of hypertension. Sorry. There are two types of hypertension. First hypertension is known as a primary or essential hypertension. First type of hypertension is known as a primary or essential hypertension. So primary or essential means what? So in this case, the cause of hypertension is not known. Primary or essential hypertension means what? So increase in the blood pressure is due to definite cause, but that cause is unknown. ये किस कारण से हो रहा है ये मालूम नहीं होता, उसको बोलते हैं प्राइमरी और essential hypertension. Okay. Now another one is there known as the secondary hypertension. Secondary hypertension or non-essential hypertension. Now secondary hypertension is because of the again due to definite cause, and in this case cause is known. So secondary hypertension is because of the different reasons. Secondary hypertension is because of the first due to renal problem. Renal means kidney. Okay, so it is secondary to renal, that is chronic glomerulonephritis. If there is an infection of glomerulus, that is glomerulonephritis. Okay, then then pyelonephritis, again polycystic kidneys, glomerulonephritis. Okay, pyelonephritis. Then that is a it is secondary. It is secondary cause due to the kidney. Okay, then again it is due to defect in the endocrine system. So if there is a excessive or inadequate secretion of endocrine hormones, so that also leads to hypertension. For example, if patient is suffering from Cushing syndrome, then pheochromocytoma, primary hyperaldosteronism. So in that case also the patient gets hypertension. So secondary hypertension is because of the secondary cause, secondary to the underlying cause. So underlying cause is maybe either problem of kidney, glomerulonephritis, pleonephritis, polycystic kidney, or endocrine disturbances or endocrine disease like Cushing syndrome, pheochromocytoma, primary hyperaldosteronism. Then again it may be due to vascular cause. Vascular cause means blood vessel problem. Okay, so it may be due to acute renal artery disease or contraction of aorta, unwanted contraction of aorta blood vessels. So secondary hypertension. So remember there are two type of hypertension: primary hypertension and secondary hypertension. Primary hypertension, in that case you don't know the cause, it is due to a definite cause, but cause is unknown. Okay, in case of primary hypertension. In case of secondary hypertension, you can you know the cause. So it may be due to renal problem, it may be due to endocrine problem, it may be due to vascular problem. Okay, so these are two type of hypertension. Now you should know how hypertension is, the blood pressure is controlled. Remember this. Okay, this is very important. So you see in the in the old age, what was happening? So suppose that you are in a jungle and you are in a jungle and suddenly in front of you there is one tiger. So you used to get excited and you used to prepare yourself for running or either fight with the tiger, either running away from the tiger. So in that both case your heart gets stimulated. your heart will contract faster, your heart rate will go increase. Okay, cardiac output will go increase, and ultimately blood pressure will go increase. Okay, again your peripheral blood vessels will be contracted, and that will also contribute to increase in the blood pressure. Okay, that means your sympathetic nervous system is responsible for the increase in the blood pressure, release of adrenaline, noradrenaline. So that is also responsible for the increase in the blood pressure. Okay, but जैसे आप जंगल में हो, शेर दिखता है आपको, तो उसको देखने के इमीडिएटली बाद में आपका सिंपैथेटिक सिस्टम एक्टिवेट हो जाता है, एंड सिंपैथेटिक सिस्टम एक्टिवेट होने के बाद नॉर एड्रेनलिन का रिलीज होता है, और वो क्या करेगा, वो जाएगा आपके हार्ट में, वहां पे बीटा वन रिसेप्टर को स्टिमुलेट करेगा, हार्ट रेट बढ़ाएगा, कार्डियक आउटपुट बढ़ाएगा बाय इंक्रीजिंग द फोर्स ऑफ कंट्रैक्शन। और वही नॉर एड्रेनलिन पेरिफेरल ब्लड वेसल में जाके बाय स्टिमुलेटिंग द अल्फा वन रिसेप्टर it causes the vasoconstriction, and which also increases the peripheral resistance. Because of the vasoconstriction, peripheral resistance is increased, and that both increase the peripheral resistance and increase the cardiac output, contribute to increase in the blood pressure। जब आप भाग रहे होते, जब आप भाग के घर 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 में आ जाते हो शेर से या टाइगर से, भाग के घर के पास आ जाते हो, घर में आके रिलैक्स बैठते हो, तब आपका पैरासिम्पैथेटिक नर्वस सिस्टम एक्टिवेट होता है, और वहां पे एसिटिलकोलिन रिलीज होता है, और आपका जो इंक्रीज हार्ट रेट है या फिर इंक्रीज ब्लड प्रेशर है, इंक्रीज पेरिफेरल रेजिस्टेंस है, वो नॉर्मली कम हो जाता है, इट विल नॉर्मलाइज। ओके, सो दिस इज वन। नाउ इमेजिन, तो अभी क्या हो रहा है कि अभी आप जंगल में तो कोई जाता नहीं, क्योंकि जंगल रहा है नहीं आजकल, जंगल तो सब तोड़ दिए है, अभी जंगल नहीं है तो टाइगर भी नहीं है, तो फिर आपका ब्लड प्रेशर क्यों बढ़ रहा है? आपका ब्लड प्रेशर बढ़ने का रीजन दूसरा है, बिकॉज ऑफ different reason like jealousy, hatred. Okay, so that replace that tiger with your boss, replace that tiger with your enemy, replace that tiger with your jealousy, hatred, over enthusiasm, over thinking, okay, stress। ठीक है, ये सब प्रॉब्लम आजकल है। तो ये प्रॉब्लम की वजह से क्या हो रहा है कि आपके सामने टाइगर नहीं है, फिर भी आपका एड्रेनालिन रिलीज हो रहा है, सो यू डोंट हैव एनी threat in front of you, you don't have any tiger in front of you, still your noradrenaline secretion is there, so sympathetic activation is there, sympathetic outflow is increased, and because of that increase the sympathetic outflow, what will happen? So it will increase the blood pressure by two way. First is by increasing the peripheral resistance, and by increasing the cardiac output. So that is the reason behind blood pressure. Now how there is a control of blood pressure? Okay, ये blood pressure control कैसे हो रहा है? So blood pressure is controlled by two mechanisms. Remember, blood pressure is controlled by two mechanisms. First one is known as a mechanism, that is mechanism is mediated by, where mechanism mediated by baroreceptors. First mechanism to control the blood pressure, आपके बॉडी में ब्लड प्रेशर कैसे कंट्रोल होता है? नॉर्मली है, जैसे मान लीजिए कि एक, okay, first mechanism is a baroreceptor mediated mechanism, and second mechanism is a hormonal mechanism. First mechanism is a baroreceptor mediated mechanism। अब ये baroreceptor क्या होता है? So these baroreceptor are nothing but the special type of receptor which are present in the aorta। जो हार्ट में aorta होता है, aorta में वो baroreceptor वहाँ पे present होता है, and it is like a CCTV, it will monitor the blood pressure। Okay, now if there is a decrease in the blood pressure, that baroreceptor will signal, because these baroreceptors are very sensitive to pressure change। ये baroreceptor जो होते हैं pressure change के लिए sensitive होते हैं, and as they are sensitive to pressure change, any change in the blood pressure, they will notice it, and they will send signal to brain। So baroreceptors, they are situated in the aorta, they are situated in the arc of aorta। Okay, जो हार्ट का मेन आर्टरी होता है, सबसे बड़ा आर्टरी, that is aorta। So in that aorta, these baroreceptors are situated, and these are sensitive to pressure change। So if any change in the blood pressure, that will be noticed by that baroreceptor, and that baroreceptor will signal the brain। Okay, now suppose that there is a decrease in the blood vessel, if there is a decrease in the blood pressure of your body, there is decrease in the blood pressure of your body, so what will happen? Immediately this baroreceptor, they will get stimulated, they will analyze the change। if there is any change in the blood pressure, they will monitor it। Okay, तो जैसे ही आपके ब्लड प्रेशर कम हो गया, तो baroreceptor इसको क्या करेगा? एनालाइज करेगा, वो सिग्नल करेगा आपके ब्रेन को। so then decrease in the blood pressure, that leads to stimulation of baroreceptor and sympathetic system। this baroreceptor decreases the stimulation of vas, okay, that stimulation of this baroreceptor decreases the stimulation of vasomotor center. Decrease in the blood pressure, okay, decrease in the blood pressure of your body, then your baroreceptor will monitor it, it will immediately signal to the brain. ओके जैसे आपके बॉडी में ब्लड प्रेशर कम होता है बायोरिसेप्टर एक्टिवेट हो जाएंगे वो सिग्नल देंगे ब्रेन को कि ब्लड प्रेशर कम हो गया है कुछ तो भी करो जापना तो ब्रेन क्या करेगा ब्रेन विल इंक्रीज द सिंपैथेटिक आउटफ्लो brain will stimulate the sympathetic nervous system it will release the adrenaline then again because of that there will be decreased stimulation of vasomotor center vasomotor center means vasomotor center is responsible for the control of your blood vessel caliber जो blood vessel होता है आपका उसका जो internal diameter होता है relaxation contraction so that is controlled by vasomotor center okay now if there is decrease in blood pressure immediately baroreceptor will be stimulated that will send a message to brain will increase the sympathetic outflow and it will decrease the vasomotor center by baroreceptor and that will increase okay because of that there will be increase in the sympathetic activity because of that there will be increase in the sympathetic outflow or sympathetic activity now if sympathetic activity is increased or sympathetic outflow is increased now what will happen sympathetic outflow means what it is nothing but the adrenaline okay so adrenaline will be released now this adrenaline will act on its receptor what kind of receptor so first alpha receptor and beta receptor so alpha receptor कहाँ पे होता है alpha receptor they are present in the blood vessel vascular smooth muscle of your blood vessel so whatever smooth muscles of blood vessel are there they are innervated with the sympathetic alpha receptor so this adrenaline or sympathetic increased sympathetic tone will increase the alpha 1 activity what is the response what is the role of alpha 1 receptor so it will constrict the blood it will contract the blood vessel so it will contract the blood vessel and it will increase the peripheral resistance because of the increased constriction of blood vessels in the periphery there will be increased peripheral resistance okay due to this adrenaline now adrenaline will also act on its beta 1 receptor present in the heart and it will also increase the function of beta 1 receptor so what is the function of beta 1 receptor to increase the rate of contraction and force of contraction so if there is increase in the force of contraction that means if there is increase in the cardiac output okay so if cardiac output is increased if peripheral resistance is increased that means blood pressure is increased so blood pressure is nothing but the blood pressure is equal to cardiac output into peripheral resistance so if there is an increase in the cardiac output there is increase in blood pressure if there is increase in the peripheral resistance there is increase in the blood pressure now if there is a decrease in the peripheral resistance there is a decrease in the blood pressure. If there is a decrease in the cardiac output, there is a decrease in the blood pressure. So that's how this baroreceptor mediated mechanism that acts. Okay. So VMC means vasomotor center. तो यहाँ पे और एक बार याद रखो if there is a decrease in the blood pressure so your baroreceptor will be activated okay baroreceptor will be activated they will send a message to the brain and brain will increase the sympathetic outflow increase करेगा and after because of this sympathetic outflow there is a decrease in the vasomotor center there is a decreased stimulation of vasomotor center by baroreceptor and which increases the sympathetic activity जैसे sympathetic activity increase होगा so that noradrenaline will stimulate the alpha 1 receptor present in the peripheral blood vessel and because of that there is a constriction of peripheral blood vessel and increase in the peripheral resistance okay and this noradrenaline will also stimulate the beta 1 receptor and which causes increase in the cardiac output so increase the cardiac output and increase the peripheral resistance increases the blood pressure okay that's how if your body blood pressure is decreased so what is the mechanism to counteract that आपके बॉडी का ब्लड प्रेशर कम हो गया है तो उसको काउंटरैक्ट करने के लिए कौन सा मैकेनिज्म है देयर आर टू मैकेनिज्म फर्स्ट वन इज अ baroreceptor mediated mechanism and second one is a hormonal mechanism so this was a baroreceptor mediated mechanism now we'll see the hormonal mechanism so hormonal mechanism is like that so if there is a decrease in the blood pressure जैसे आपके बॉडी का ब्लड प्रेशर डिक्रीज होता है so if there is decrease in the blood pressure there will be decrease in the blood pressure so obviously if there is a decrease in blood pressure there will be decreased the blood flow to the kidney अगर आपका ब्लड प्रेशर डिक्रीज हो गया तो किडनी को या फिर बाकी ऑर्गन्स जो भी है उनको ब्लड क्या होगा कम हो जाएगा so if there is a decrease in the blood pressure there will be decrease the blood flow to kidney and decrease the blood flow to the kidney leads to activation of this system known as the renin angiotensin aldosterone system renin angiotensin aldosterone system activation of renin angiotensin aldosterone system so decrease the blood flow causes activation of this system again this decrease the blood flow to the kidney decrease the blood flow to the kidney will decrease the glomerular filtration rate. So it will decrease the GFR. Okay, decrease the blood flow to the kidney will activate the renin angiotensin aldosterone system. Decrease the blood flow to the kidney will also decrease the glomerular filtration rate. ये glomerular filtration rate decrease हो गया, उसके बाद में क्या होता है, सोडियम एंड वाटर रिटेंशन होता है. So decrease the GFR leads to retention of sodium and water. Okay, this decreased renal blood flow, decreased blood flow to kidney causes a release of renin. Renin is an enzyme. Renin is a enzyme which is produced in the kidney. Okay, sorry, renin is a hormone produced in the kidney. So renin, जैसे blood flow कम होता है kidney को, तो renin का release हो जाएगा. Now this renin is involved in the conversion of inactive peptide known as a एंजियोटेंसिनोजेन. यहाँ पे एक इनएक्टिव पेप्टाइड होता है एंजियोटेंसिनोजेन. So it will convert, this renin will convert angiotensinogen into angiotensin 1 and angiotensin 2. So renin will convert angiotensinogen into angiotensin 1 and angiotensin. Now this angiotensin 2 is a octapeptide. It is a octapeptide, and this is known as a, it is known as a pressure agent. Pressure agent means this angiotensin 2 cause, it will cause the vasoconstriction. It will cause the vasoconstriction. It will cause the vasoconstriction. And again this angiotensin 2 will also cause secretion of aldosterone, and aldosterone is known as a antidiuretic hormone. जो aldosterone का secretion बढ़ाएगा, ये vasoconstriction करेगा. जैसे vasoconstriction किया इसने angiotensin 2 ने, तो vasoconstriction करेगा तो क्या होगा, पेरिफेरल रेजिस्टेंस क्या होगा, बढ़ जाएगा. और दूसरे साइड पे क्या करता है ये angiotensin, it will also stimulate the aldosterone secretion, which also leads to increase in the sodium and water retention. Sodium water retention होता है मतलब क्या, blood volume बढ़ जाएगा. Okay. So if there is an increase in the sodium and water retention, so which is done by two different mechanisms, sodium and water retention. So there is a reabsorption of sodium and water through kidney because of the decreased glomerular filtration rate. Why this is decreased? Because of the decreased blood flow to the kidney. Decreased blood flow to the kidney, okay, will cause two problems. So first it will decrease the GFR, and it will also stimulate the renin release. Renin release, and renin is the hormone which convert angiotensinogen into angiotensin 1 and angiotensin 2. Now this angiotensin 2 is a vasopressor. It is a vasopressor. So this angiotensin 1, angiotensin 2, that is a octapeptide, it will cause first vasoconstriction, which increases the peripheral resistance. And this angiotensin 2 on the other hand, it will also stimulate the aldosterone. So aldosterone is known as a antidiuretic hormone. Aldosterone increase level हो जाएगा उसका, and this increase the level of aldosterone will cause increase the sodium and water retention, and this sodium water retention increases the blood volume. Okay, blood volume जैसे increase होगा, आपका cardiac output increase हो जाएगा. So increase in the cardiac output, increase in the peripheral resistance, that increases the blood pressure. So that is known as a hormonal mechanism. So remember, if there is a decrease in the blood pressure in your body, so decreased blood pressure means there is a decreased blood flow to kidney. Okay, so there is a decreased blood flow to kidney. That means decreased blood flow to the renal system, and decreased blood flow to kidney causes activation of this renin angiotensin aldosterone system. Now decreased blood flow to the kidney means decreased glomerular filtration rate, decreased GFR, okay, and decreased blood flow to kidney causes release of this hormone known as a renin, and renin is the hormone responsible for the conversion of angiotensinogen, which is inactive peptide angiotensinogen, and it will convert angiotensinogen to angiotensin 1, which is known as a decapeptide. Angiotensin 1 is known as a decapeptide, and angiotensin 1 is converted into angiotensin 2, which is known as a octapeptide. यहाँ पे याद रखो, एंजियोटेंसिन 2 क्या है, ऑक्टापेप्टाइड है, एंजियोटेंसिन 1 क्या है, डेकापेप्टाइड है. इसके ऊपर क्वेश्चन आ चुका है. नाउ दिस एंजियोटेंसिन 2 इज अ वैसोप्रेसर. ये क्या करेगा, ब्लड वेसल को कंस्ट्रिक्ट करेगा, एंड क्या करेगा, vasoconstriction. Because of this vasoconstriction, there is an increased peripheral resistance. Okay, at one hand. At another hand, this angiotensin 2 causes the release of aldosterone. Aldosterone is an antidiuretic hormone, so it will cause sodium and water retention. Okay, sodium water retention करेगा, मतलब blood volume increase करेगा, and this again, this decreased glomerular filtration rate will also cause sodium and water retention. And sodium and water retention means increase the blood volume. Increase the blood volume means increase the cardiac output. Okay, so this cardiac output is increased, the peripheral resistance is increased. That means blood pressure is increased. That's how blood pressure is controlled by two mechanisms. First one is nothing but the your baroreceptor mediated mechanism. Second one is nothing but the hormonal mechanism. Okay, you can see again here control of blood pressure. Normally blood pressure body में कैसे control होता है? So control of blood pressure. Arterial pressure is a function of cardiac output plus peripheral resistance. So what is blood pressure? Blood pressure is equal to cardiac output into peripheral resistance. It is a formula for blood pressure. तो जितना कार्डियक आउटपुट है बढ़ेगा उतना ब्लड प्रेशर बढ़ेगा, जितना पेरिफेरल रेजिस्टेंस बढ़ेगा उतना ब्लड प्रेशर बढ़ेगा. So because this blood pressure is a product of your cardiac output and peripheral resistance. Okay, so blood pressure is controlled by two systems. So it is two systems. First one is known as adrenergic nervous system. So acute change in the blood pressure, if there is any change in the blood pressure, okay, acute change in the blood pressure, that is monitored by baroreceptor, present in the arc of aorta, and which is influenced by adrenergic nervous system. If there is a decrease in blood pressure, this baroreceptor will signal the brain and there will be increased sympathetic outflow or sympathetic functions. Okay, now this is the one. And second one is the renin angiotensin aldosterone system. Second one is known as the renin angiotensin aldosterone system. So this renin angiotensin system is slow, but okay, it will regulate the blood pressure long term. So this renin angiotensin system, they are slow. Okay, it is slow but it will regulate the blood pressure for long term. Now renin क्या है? It is a proteolytic enzyme. Renin is a proteolytic enzyme produced by kidney. Remember इसके ऊपर भी क्वेश्चन आता है. Renin is a produced in one of the following organ. Renin is a proteolytic enzyme produced in the kidney. Okay, proteolytic enzyme, okay, which is released upon two signals. If there is a decreased renal perfusion pressure, जैसे किडनी को ब्लड प्रेशर कम हो जाएगा तो रेनिन रिलीज हो जाएगा. Decreased supply of sodium to the mucosa densa, जैसे सोडियम का सप्लाई किडनी में कम हो जाएगा तो वो तब भी आपका रेनिन रिलीज होगा. तीसरा रीजन क्या है? इंक्रीज इन द एड्रेनर्जिक एक्टिविटी. चौथा रीजन क्या है? सर्टन हार्मोनल फैक्टर्स. सो इफ देयर इज अ डिक्रीज द ब्लड फ्लो टू द किडनी, if there is a decreased supply of sodium to the macula densa is a particular area of your kidney, then the increase in the adrenergic activity and certain hormonal factors, these factors contribute to the release of renin in the kidney. Now what is the function of renin? So renin will convert this angiotensinogen. Renin will convert this angiotensinogen, which is known as a serum globulin. It is a globulin. Okay, albumin globulin जैसे प्रोटीन होता है. So angiotensin is a globulin, serum globulin, and this angiotensinogen is converted into angiotensin 1. Angiotensin 1. Okay, it is converted into angiotensin 1. Angiotensin 1 is a decapeptide. Deca means 10. Deca means 10. Is a decapeptide. Okay, which during the passage, which this angiotensin 1 during the passage into lungs, ये angiotensin 1 lungs में जाता है and it will be converted into another known as angiotensin 2. Angiotensin 2 is an octapeptide and it is converted by enzyme known as angiotensin converting enzyme. Is converted by angiotensin converting enzyme. Now renin का काम क्या है? renin का काम है कि angiotensin जो inactive plasma globulin है, okay, so that inactive plasma globulin known as angiotensin is converted into angiotensin 1 by renin. So angiotensin 1, you will get angiotensin 1 which is a decapeptide, and now this angiotensin 1 is converted into angiotensin 2 which is octapeptide by angiotensin converting enzyme. Okay, ACE, angiotensin converting enzyme. Okay, now angiotensin 2 क्या है? Angiotensin 2 is the most powerful vasoconstrictor. Okay, remember angiotensin 2 is the most powerful vasoconstrictor. It is a powerful vasoconstrictor and also stimulate the release of aldosterone. So angiotensin 2 क्या करेगा? ब्लड वेसल को कंस्ट्रिक्ट करेगा, पेरिफेरल रेजिस्टेंस बढ़ाएगा, एंड एक साइड पे ये करेगा, दूसरी साइड पे क्या करेगा? अल्डोस्टेरोन का रिलीज करेगा. अल्डोस्टेरोन रिलीज करेगा तो सोडियम वाटर रिटेंशन होगा, ब्लड वॉल्यूम इंक्रीज हो जाएगा. जैसे ब्लड वॉल्यूम इंक्रीज होता है कार्डियक आउटपुट इंक्रीज हो जाएगा और पेरिफेरल रेजिस्टेंस भी इंक्रीज कर चुका है ये angiotensin 2 by its vasoconstrictor effect. So that leads to increase in the blood pressure. So remember angiotensin. Now after that angiotensin second जो है that is converted into angiotensin 3. So angiotensin 1 is a decapeptide, angiotensin 2 is the octapeptide, and after angiotensin 2 is converted into angiotensin 3 which is a heptapeptide. तो angiotensin 1 में decapeptide मतलब 10 पेप्टाइड बॉन्ड्स. ओके, एंजियोटेंसिन 1 में 10 पेप्टाइड बॉन्ड होते हैं, एंजियोटेंसिन 2 में 8 पेप्टाइड बॉन्ड होते हैं, 8 मतलब ऑक्टा. ओके, एंड एंजियोटेंसिन 3 में 7 पेप्टाइड बॉन्ड होते हैं, 7 पेप्टाइड बॉन्ड्स. दैट इज एंजियोटेंसिन 3. इसके ऊपर क्वेश्चन आ चुका है. सो व्हिच वन इज अ ऑक्टापेप्टाइड, व्हिच वन इज अ डेकापेप्टाइड, व्हिच वन इज अ हेप्टापेप्टाइड. सो एंजियोटेंसिन 3 इज अ हेप्टा, एंजियोटेंसिन 2 इज अ ऑक्टा एंड एंजियोटेंसिन 1 इज अ डेका. ठीक है, डेका मतलब. ओके, एंड एंजियोटेंसिन 3 इज अगेन वेरी पावरफुल वैसोकंस्ट्रिक्टर. तो ये एंजियोटेंसिन 2 एंड एंजियोटेंसिन 3 दोनों भी क्या है, वैसोकंस्ट्रिक्टर है. ठीक है, तो आपको यहाँ पे ये मालूम हो रहा है कि रेनिन रेनिन का रिलीज होने के बाद एंजियोटेंसिन कन्वर्ट होता है एंजियोटेंसिन 1 में, और उसका बाद में एंजियोटेंसिन 2 बनता है बाय एस, एंजियोटेंसिन कन्वर्टिंग एंजाइम. और एंजियोटेंसिन कन्वर्टिंग एंजाइम बनेगा आपका एंजियोटेंसिन 2. ठीक है, और एंजियोटेंसिन 2 क्या है, वैसोकंस्ट्रिक्टर है एंड एल्डोस्टेरोन का सेक्रेशन बढ़ाता है. उसका मतलब है सोडियम वाटर रिटेंशन होगा, ब्लड वॉल्यूम बढ़ाएगा और पेरिफेरल बढ़ेगा, ब्लड प्रेशर बढ़ाएगा बढ़ाएगा. तो आपको ब्लड प्रेशर कम करना है तो क्या कर सकते हो आप, रेनिन को इनहिबिट करो. उसको नहीं कर सकते तो एंजियोटेंसिन कन्वर्टिंग एंजाइम को इनहिबिट करो. उसको नहीं कर सकते हो तो एंजियोटेंसिन सेकंड जो बना है वो उसके रिसेप्टर के ऊपर जाके एक्ट होगा, उसको इनहिबिट करो. उसको भी नहीं कर उसको करो इनहिबिट. ठीक है, देन एंजियोटेंसिन सेकंड, एंजियोटेंसिन 3 is also angiotensin third is also a powerful vasoconstrictor. So remember over here angiotensin 1 is a decapeptide, angiotensin 2 is a octapeptide, angiotensin 3 is a heptapeptide. Okay, now kidney plays important role in the determining the blood pressure level. Okay, and it does by renin angiotensin aldosterone system. So kidney क्या करता है, आपका ब्लड प्रेशर रेगुलेट करता है. So kidney regulate the blood pressure by this regulation of aldosterone, regulation of angiotensin, regulation of renin angiotensin aldosterone system. So kidney plays a very important role in the regulation of blood pressure via this system known as the renin angiotensin aldosterone system. It is very important, you have to remember this, particularly this. Okay, angiotensin 1 is a decapeptide, this angiotensin 1 is a decapeptide, angiotensin 2 is a octapeptide, and angiotensin 3 is nothing but the heptapeptide. Okay, heptapeptide. Okay, remember the role of renin. Renin will convert angiotensinogen, which is a inactive globulin, will convert angiotensinogen into angiotensin 1 renin. Okay, now this angiotensin 1 will travel in the lungs and it will be converted into angiotensin 2 by the enzyme angiotensin converting enzyme ACE. Okay, angiotensin second is a powerful vasoconstrictor and releases the aldosterone which increases the blood pressure. Now angiotensin second is converted into angiotensin 3 or angiotensin third, which is a heptapeptide, which is also again vasoconstrictor. So remember, this is a second mechanism known as a hormonal mechanism. Kidney plays important role in the determining the blood pressure by renin angiotensin aldosterone system. Now what are the other important points from this? If there is a deficient in the vascular synthesis of nitric oxide, so if blood vessels is deficient in the synthesis of nitric oxide, आपका जो ब्लड वेसल है उसमें अगर कोई डैमेज हो गया है, सो इफ देयर इज एंडोथेलियल डैमेज टू द ब्लड वेसल, so this nitric oxide will not be there. So nitric oxide is known as a endothelium derived relaxing factor, EDRF, capital EDRF. Nitric oxide is known as a endothelium derived relaxing factor, so it relaxes the blood vessel. So there is a deficient vascular synthesis, that is nitric oxide, in the hypertensive subject. There is a positive correlation between total body sodium and negative correlation between total body potassium in the hypertensive patient. जिसको हाइपरटेंशन है उसका ब्लड वेसल जो है वो इनएडिक्वेट नाइट्रिक ऑक्साइड सिंथेसिस करेगा एंड वहां पे क्या रहेगा, उसका सोडियम लेवल बढ़ गया होगा, ब्लड प्रेशर जिसका उसका सोडियम लेवल बढ़ जाता है एंड पोटेशियम लेवल कम हो जाता है. सो देयर इज अ पॉजिटिव कोरिलेशन बिटवीन टोटल बॉडी सोडियम एंड ब्लड प्रेशर एंड नेगेटिव कोरिलेशन बिटवीन टोटल बॉडी पोटेशियम एंड ब्लड प्रेशर. पोटेशियम डिक्रीज हो जाएगा, उनका सोडियम लेवल बढ़ जाएगा. दैट्स व्हाई वो ब्लड प्रेशर के पेशेंट को बोल देते हैं कि आप सॉल्ट कम खाओ. क्यों? इसकी वजह से. नाउ सम पेशेंट, ओके, नाउ सम पेशेंट विद essential hypertension In the some in the few patients, essential hypertension is related with the insulin resistant insulin resistance with the resultant hyperinsulinemia. तो इंसुलिन का रेजिस्टेंस जिनको होता है उनमें भी ब्लड प्रेशर आ जाता है. देन सिंथेसिस ऑफ एबनॉर्मल स्टेरॉइड. ओके, सिंथेसिस ऑफ एबनॉर्मल स्टेरॉइड लाइक हाइब्रिड बिटवीन कॉर्टिसोल एंड अल्डोस्टेरोन. तो ब्लड प्रेशर इसके वजह से भी होता है कि डिफेक्टिव और हाइब्रिड सिंथेसिस ऑफ कॉर्टिसोल एंड aldosterone. So इनका बीच में का एक मॉलिक्यूल सिंथेसिस होता है. That is because of that also hypertension is there. Remember these points. These points are very important. Renin angiotensin converting system, how it will act, how there is a baroreceptor mediated mechanism. Okay, and what are the other important points? There is a damage to a vascular endothelium in case of hypertensive subject. जिनको hypertension है उनका नाइट्रिक ऑक्साइड सिंथेसिस कम होता है. उसके बाद में उनका सोडियम लेवल बढ़ जाता है, बॉडी का पोटेशियम लेवल कम हो जाता है. और जिनको इंसुलिन का रेजिस्टेंस है उनमें भी ब्लड प्रेशर आ जाता है. और जिस भी पेशेंट में ये हाइब्रिड मॉलिक्यूल सिंथेसिस होता है, जैसे कॉर्टिसोल एंड अल्डोस्टेरोन के बीच में का मॉलिक्यूल सिंथेसिस होता है, उनमें भी क्या होता है, हाइपरटेंशन होता है. दीज आर द रीजन. नाउ क्लासिफिकेशन ऑफ एंटी हाइपरटेंसिव ड्रग. तो इसमें इतना सिंपल है, मैं आपको बोलता हूँ कि यू कैन इजीली रिमेंबर द क्लासिफिकेशन ऑफ एंटी हाइपरटेंसिव ड्रग. तो आपको ये मालूम होना चाहिए कि ब्लड प्रेशर क्यों बढ़ रहा है. सो फर्स्ट रीजन फॉर इंक्रीज इन द ब्लड प्रेशर, दैट इज अ सिंपैथेटिक आउटफ्लो. ठीक है, सो देयर इज इंक्रीज्ड सिंपैथेटिक आउटफ्लो. सो नॉर एड्रेनालिन ज्यादा रिलीज हो रहा है. ठीक है, सिंपैथेटिक आउटफ्लो. हाउ कैन यू प्रिवेंट दिस सिंपैथेटिक आउटफ्लो? You have different targets. You can prevent the this release of sympathetic or this you can prevent the activation of sympathetic nervous system by central alpha 2 agonist. So central alpha 2 means, so whatever alpha 2 receptor which is present in the presynaptic neuron that regulate the release of noradrenaline in the brain. So you can avoid the release of noradrenaline in the brain by this central alpha 2 agonist. Second target will be your if that is released, so it will act on its post-synaptic receptor. Okay, that is a ganglia. In the ganglia it will act. So ganglionic blockers are used. Okay, then again, if still you cannot block, so if there is a release, finally if there is a release of noradrenaline, so what you can do, you can block the interaction of noradrenaline with its receptor. So alpha blockers and beta blockers. Alpha blockers and beta blockers, they are used. Then again, next target will be your why blood pressure is increasing, because of the increased peripheral resistance. So why peripheral resistance is increased? Because of the vasoconstriction. So why? Okay, so use vasodilators. So like your sodium nitrophosphatide, calcium channel blockers, etc., etc. Okay, so these are the vasodilators. Again, why blood pressure is there? Because of the activation of your renin angiotensin aldosterone system. So you can block that also in the different steps. Like first you can block the renin, function of renin. So renin inhibitors can be used. So they will prevent the conversion of angiotensinogen to angiotensin. Okay, so if you cannot do that, you can prevent the formation of angiotensin second by inhibiting the angiotensin converting enzyme, ACE inhibitors. If you cannot do that, you can prevent the interaction of angiotensin second with its receptor, that is by angiotensin receptor blockers. Okay, if you still you cannot do this, you can use aldosterone antagonist, which increases the your aldosterone, which increases the blood volume. You can prevent that by using aldosterone antagonist. And still you cannot do this, you can decrease the blood volume by using diuretics. Okay, so these are the different way. Okay, we'll see it while I will explain this while explaining the uh, classification. Okay, so classification of anti-hypertensive drug. So first class will be your centrally acting drugs. Centrally acting drugs. So in that you have central alpha 2 agonist, central alpha 2 stimulants, or central alpha 2 agonist. So what is the example? Example is nothing but the methyl dopa and clonidine. Okay, then centrally acting drug, second class is nothing but the selective imidazole receptor stimulant, selective imidazole receptor agonist. So example is moxonidine, moxonidine. So this was again asked, इसके ऊपर भी क्वेश्चन आ चुका है जीपैट में. Which one is the selective imidazole agonist used in the hypertension? It was question in GPAT 2018. Selective imidazole receptor agonist, stimulant or agonist, same term. Selective imidazole receptor agonist कौन है यहाँ पे? Moxonidine. Now second class is nothing but the ganglionic blocker. For example, trimethophan, ganglionic blocker trimethophan. And third class is nothing but the drug acting on post-ganglionic sympathetic nervous. In that you have adrenergic neuron blockers. Adrenergic neuron blockers. Example is gonithidine, then vithanidine, then debrisopin and bredylium tocilin. Okay. Then catecholamine depleters like reserpine. So एक दो तीन class हो गए. Now fourth class is nothing but the drug acting on adrenergic receptors. So mostly alpha blockers and beta blockers. So alpha blockers, in that you have selective alpha blockers. Here example is nothing but the pentolamine, phenoxybenzamine, then indoramine, prazosin, terazosin, doxazosin, etc. Then beta blockers, okay, propranolol, atenolol, metoprolol. Then alpha plus beta blocker, non-selective. So labetalol. So okay, 1, 2, 3, 4, 5. These are the 5 classes. Now again, next class will be your vasodilators. So what will vasodilator do? They will dilate the blood vessel and they will decrease the peripheral resistance. Okay, vasodilators. Now vasodilators again classified into two types. Those dilate the arteries, then are these those dilate the arteries known as a arteriodilator. Those dilate the veins, they are known as venodilator, and those dilate the bone, known as the arterio plus venodilator. So first one is a arteriolar vasodilator. जो arteries को dilate करेंगे. कौन है example देखो यहाँ. Calcium channel blockers, hydroxyzine, diazoxide and minoxidil. So calcium channel blocker में आता है आपका verapamil and diltiazem. Okay, verapamil, diltiazem are classic calcium channel blocker. Hydroxyzine and diazoxide, it is a vasodilator. They act by increasing the nitric oxide in the blood vessel. Minoxidil is also a vasodilator, and this is used in the hair growth promotion. It is used in the hair growth promotion, baldness. Then next class from vasodilator is atriovenular vasodilator. Means they will dilate both arteries as well as veins. So example is sodium nitroprusside. Sodium nitroprusside. Then next class will be calcium channel blockers. So example is verapamil, latiazem, okay, nifedipine, amlodipine, okay, isradipine. So dapines are nothing but the dihydropyrimidine derivative. Dapine जो है, they are also calcium channel blocker, but they are a dihydropyrimidine derivative. Verapamil and diltiazem. Verapamil is made up of two amino acids. Okay, we'll say I will explain this again at the time of individual. Next class will be your potassium channel activator. So diazoxide, minoxidil, pinacidil and nicorandil. Diazoxide, minoxidil, pinacidil, nicorandil. These are the potassium channel activator. Next class will be your drug acting on renin, angiotensin, aldosterone system. तो मैंने बोला उसमें first will be renin inhibitors. So like beta blockers are the renin inhibitors also. Then particularly this alikyrasin, L-kyracine and another drug is there, kyrasins. So all kyracine are nothing but the renin inhibitor. Renin inhibitors. L-kyracine and calicyracin. L-kyracine and calicyracin. They are the particularly renin inhibitor. So renin inhibition or renin release inhibition is also done by beta blockers. The next one is ACE inhibitors, angiotensin converting enzyme inhibitors. Captopril, enalapril, lisinopril, fosinopril, quinapril, ramipril. Captopril, enalapril, lisinopril, fosinopril, quinapril and ramipril. ठीक है. So beta blocker क्या है आपका जो propranolol, atenolol, bisoprolol, labetalol, carvedilol जो लॉल से they are the beta blocker. जो जोसिन से prazosin, terazosin, doxazosin, pentolamine, indoramine, all these are the alpha blockers. Captopril, enalapril, lisinopril, fosinopril, quinapril, these are the ACE inhibitors. Now second is in that third one is angiotensin receptor blocker. So sartans, losartan, ibrasartan, valsartan, okay, telmisartan, these are nothing but the angiotensin receptor blocker. Losartan, telmisartan, ibrasartan, valsartan. Then next class again is aldosterone antagonist. For example, spironolactone. Spironolactone is an aldosterone antagonist. Diuretic, for example, diuretic. In that case also, you have different kind of diuretic like osmotic diuretics, like furosemide, potassium sparing diuretic like trimetrin and amine. Okay, then thiazide diuretics like chlorothiazide, hydrochlorothiazide. So in diuretics also you have different classes. Then miscellaneous drug, for example, metyrosine. So it is known as a false neurotransmitter. So this is how there is a classification. Again, we are going to see this classification 3 times at least. So again, you can see over here, anti-hypertensive drugs. Okay, anti-hypertensive drug. So here, first class is a diuretic. Diuretics means what? They will decrease the blood volume and they will decrease the cardiac output. So in that you have different classes like thiazide diuretics, like hydrochlorothiazide, chlorothiazidone, indapamide. Then high ceiling diuretics, they are also known as a high ceiling diuretics. They are also known as osmotic diuretics. They are, for example, furosemide. Okay? Furosemide is there. Then potassium sparing diuretics. In that case, you have spironolactone, eplerenone, and amiloride. Okay, so amiloride, eplerenone, and spironolactone. These are the potassium sparing diuretic. High ceiling diuretics, furosemide, and other high ceiling. Thiazide is then second class will be your renin-angiotensin system inhibitors. Renin-angiotensin system inhibitors. In that you have different classes. Okay, in that you have 3 subclasses. First one is known as ACE inhibitors, angiotensin converting enzyme inhibitors: captopril, enalapril, lisinopril, perindopril, ramipril, fosinopril, quinapril, trandopril. These are the drugs. Okay, example. Then next class in that you have angiotensin receptor blocker, AT1 receptor blocker, angiotensin receptor 1 blocker, losartan, candesartan, valsartan, telmisartan, ibrasartan, all the sartan, olmesartan, all these are the angiotensin receptor blocker: telmisartan, losartan, valsartan, ibrasartan, etc. Then direct renin inhibitor or renin antagonist, aliskiren and calicaren. These are the direct renin inhibitors. Then next class is nothing but the sympathetic inhibitors. So in that you have 2 subclasses. In that you have three subclasses. Sorry, 4 subclasses. Okay, so indirect inhibitor or central inhibitor and sympathetic inhibitor में 4 क्लास होता है. फर्स्ट वन इज अल्फा, फर्स्ट वन इज बीटा ब्लॉकर्स. ओके, सो बीटा ब्लॉकर्स में आएगा आपका लॉल्स, प्रोप्रानोल, मेटोप्रोल, अटेनोल. देन अल्फा प्लस बीटा ब्लॉकर्स मतलब नॉन सिलेक्टिव, कार्वेडाइलोल एंड लेबेडोलोल. ठीक है, उसमें और एक आएगा अल्फा ब्लॉकर्स, सिलेक्टिव अल्फा ब्लॉकर्स. सिलेक्टिव अल्फा ब्लॉकर्स में क्या आएगा आपका प्राजोसिन, टेराजोसिन, डॉक्साजोसिन, प्राजोसिन, टेराजोसिन, डॉक्साजोसिन, tamsulosin, pentolamine, and enoxabenzoamide. Okay, these are the alpha adrenergic blocker. So prazosin, terazosin, and doxazosin. These are known as selective alpha blocker, and other are the non-selective. Then central sympatholytics. So central alpha 2 agonists like clonidine, methyl dopa. Okay. Then again in this continuation another classification is there. So vasodilators, antihypertensive classification. So in that you have direct vasodilators and calcium channel blockers. In that you have calcium channel blockers. So in that you have 3 subclasses. Okay, so those are phenylalkylamine derivative. So verapamil is a phenylalkylamine derivative. याद रखो, क्वेश्चन आ चुका है इसका. Then benzothiazepine derivative, इसके ऊपर भी क्वेश्चन आ चुका है. So deltiazem is a benzothiazepine derivative. And dihydropyrimidines, all the dipines, nifedipine, pyrrolidipine, amlodipine, nitrodipine, lacidipine, then lurcanidipine and benzidipine. These are the nothing but the dihydropyrimidines. All these are the calcium channel block. Next one is the vasodilators. So in that you have arterial vasodilator or arterio plus veno. So those dilate only artery, known as arteriolar dilator, hydrolyzine, minoxidil and diazoxide. Then those dilate both arteria plus venous, known as sodium nitroprusside. Okay, so they will, all these drug, what will they do? They will decrease the peripheral resistance. ये drug क्या करेंगे? Peripheral resistance decrease करेंगे. Now again you can see the class.